There is a situation when natural milk production takes a setback. This has to be understood. There is no way that any doctor will promote any product that is damaging to the baby. If they are having nutritional deficiencies, what do mothers have to do? You should not hold back yourself and you should not judge yourself as a mother and never follow social media trends saying that this is not good, that is not good. You cannot be judged.
Hello, doctor. Why children doctors are promoting formula milk?
It's a very good question, and it is very important to understand this point. Why pediatricians and neonatologists, sometimes obstetricians, also ask post delivered mothers to give formula to their children. Formula milk is one of the safest milk only after mother's milk. After delivery, if the mother is stressed out or dehydrated or not in a condition to produce milk, or if she is having any latching issues, or there is any difficulty in her presence along with the baby, like if the baby is gone to the NICU, there is a situation when natural milk production takes a setback. In such conditions, to prevent dehydration in the babies and to prevent neonatal jaundice and all, if the mother's milk is not sufficient, there is a position where pediatricians, neonatologists have to promote formula milk of that right age. If it is a preterm baby, then preterm formula milk. If it is a term baby, term formula milk. Or if the babies are having allergy to any of mother's milk or lactose or any other problems, then there are special formula milks given for that special situation. And this has to be understood. There is no way that any doctor will promote any product that is damaging to the baby. It is only situational. Like how we promote, formula for the right situation when there is deficiency in maternal milk production or where there is a high demand and low supply. In a similar way, young children at times they don't eat food properly. There are nutritional deficiencies. There are lapses in their food intake. If they are having nutritional deficiencies, what do mothers have to do? Mothers like me who have 3 children, I am working and I am busy. At times, they are cranky and they are moody and they would not want to have always rich nutritional diet in their food. Then what else can we do? Sometimes we also have to give young children some kind of a milk mix or some kind of a multivitamin syrup or some kind of gummies or anything just to replenish those lapses and to give that little boost. If they are not eating protein rich diet, maybe because of various reasons like likes, dislikes, indigestion, or certain demand situations post fever, and all these things, you should not hold back yourself and you should not judge yourself as a mother that I am doing right or wrong. You should always think in a way that situation is demanding, then you can opt for temporary methods like giving some milk mix or some nutritional supplement in the form of syrups or gummies or anything that is given in a similar way. Now, with all these things come advantages, disadvantages. Advantages are your baby is taken care of the rightful needs that the baby has. You will also get the time to address the situation and take the baby in the right track, give nutrition, and then slowly improve the natural nutrition process that comes in, like how we give, breastfeeding, encourage latching, encourage milk output from the mother, encourage her with good diet, encourage, rooming in, encourage skin to skin contact. Likely, the milk output increases. In a similar way, you should first correct nutritional deficiencies and tantrums in children and slowly improve oral intake, nutritious diet, and improve the intake and make sure that the mainstream is food itself. But when the baby is not ready, you should not be stubborn and never follow social media trends saying that this is not good, that is not good. You cannot be judged. Being a mother is equal to taking your own responsibility. And what is your problem? You can understand. Some doctor sitting somewhere will never understand. And there is a time that you have to adjust to situations. And when you're trying to give some products, make sure you check the label properly. What you want, and is it safe or not? Is it devoid of harmful substances? And make sure that your children are active, playing around, playing some sports, and do not make them couch potatoes. Not only this, it is also important to take care of their dental hygiene. Yes, certain gummies and certain products have issues with dental caries. But if you properly brush your teeth and teach them about dental health, you should never have any issues. And there are so many doctors saying that you can have choking with gummies and all. It's all rubbish. Because if you are there in front of the baby and you're giving gummy and the baby's chewing and taking the gummy, why would you have choking? Choking is seen more in playful things, and even with chapatis, and if you gulp food, even when the baby is sitting on a dining table and eating normal food. So choking with gummies is not always true. Yes, you should be careful. Yes, you should be very observant about what is happening with the child and keep the gummies far off where they cannot be reaching them just like that and playing with them. So it's important and always not to be judged in situations. I'm a mother, I'm a doctor, and even I have to give certain things in certain situation when the situation demands. So being a mother is the most difficult thing. Take your own decision, and what quality of product and what product is given to your child is your due diligence. Never follow whatever everybody is saying rather than you judge. For me, if I give my children jaggery, if I give my children millets, if I give them sugar free products, I make sure that they eat them or in limited quantities and burn them by playing around along with their peers. And if I give them the safety products, it is my due diligence to check the label. I take a huge responsibility of my social media family. And this is me, Dr. Shilpi, unfiltered. This is my view. And whatever said and done, life is there and you have lot of choices. And choices are tremendous, but always choose your choices wisely. There are people influencing, but influence should not be a decision maker of your choices. Health is something that every woman should take care of herself and her children. And these days, there are so many fads, there are so many fancy things happening, but there is only one truth, that everything is not the same way. Every child is different, every mother is different, every situation is different. When situations vary, when situations are different, you have different choices. Your choice is defined by how your child is. So, me as a mother and as an influencer have huge responsibility towards yourself. Every coin has two sides. It's your responsibility to see both the sides and decide which is the one that is your choice. So, when there are positives about a thing, there will always be negatives. Yes, formulas have negatives because they are diluted with water. Infection can be a source that is coming from water. You can have other nutritional issues. But the safety way of making it and giving it and the need makes it more important. Nobody is going to promote anything unless and until it is needed. And there are several influencers out there and doctors out there who talk sense, who talk nonsense, depending on what kind of a negative or positive publicity that they want. It's irrespective of all these things. You can choose what is right for you. I choose what is right for my children. And if that is the right choice, I usually promote it because I feel that when I can have good outcomes out of it, then definitely my social media family can benefit with it. So, this is Dr. Shilpi signing off, and wait for another unfiltered me next week.